On your graph here, Vikram, say the start of your climb here, where you've got your peaks and flows, say a woman is around about 60-ish. Okay, she does a Brexane and whatever. Say she gets up to the 3/4 of the way up. Because of her age, can her breast cancer be less aggressive than someone that starts down the bottom at a much younger age?
So it's a very good question, and the answer is actually very complicated.
Did everyone hear the question at the back? Yep.
So the answer is very complicated, and the answer is that the aggressiveness of someone's breast cancer depends on whether it's HER2 positive, whether it's estrogen. So when we look at someone's breast cancer, we look at few things. So the first thing we look at is, if say somebody had early stage breast cancer, we look at the size, we look at number of lymph nodes, we look at the grade of the cancer, we look at ER positivity, PR positivity, we look at HER2. We've also started now looking at Ki-67, and there are heaps of genetic markers you can have a look. And then we use all this information in advanced breast cancer, plus another is the volume of disease.
And is the age coming there as
Yes,
well?
absolutely. Because I'll give you an example. If a kid fractures this bone, they heal up in 2.5 weeks. So their plaster is only put on for 2.5 weeks. An adult, 50, 60, fractures, they heal up in 4 weeks. So the plaster is after 4 weeks. Old people over the age of 80 may not heal it for 2 months. So what it means is that our body's ability to handle any kind of stress decreases over time. Our body's ability to repair itself decreases over time. And chemotherapy is like poison. And the difference is it poisons the cancer cells more than the normal body tissue. So the younger you are, the fitter you are, the less medical problems you have, the more likely you are to be able to tolerate full dose chemo. In which case, because your normal body tissues is working. The more medical problems you have, the frailer you are, the worse the chemo will make you feel, and the more difficult and challenging it would be to give you full dose chemo. So the tolerability is there, and the aggressiveness is also there, but it also in many ways depends on the markers. So if somebody has younger breast cancer, then they usually tend to have more aggressive breast cancer. And the second thing is what we also causes competitive causes of mortality. What it means is, what are the chances of this woman or this person dying from something else unrelated to their breast cancer in the next 5 years? If you are over the age of 60, you have multiple medical problems, the chances of dying from something else in 5 years is close to 34%, heart attack, stroke, diabetes, kidney failure. If you are 40, you are fit, you've got no medical problem, the chance is 1%. So what it means is, if you get diagnosed with breast cancer at the age of 40, which is secondary, more than likely you will die from that breast cancer. If you get diagnosed with secondary breast cancer at the age of 75 or 80, you may or may not die from your breast cancer. You may die with your breast cancer if it's slow growing and controlled.